So the first technique we're going to review is called the ankle brachial index. This is a measurement of lower extremity circulation. We calculate this by taking 3 systolic blood pressures in the lower extremity, averaging those numbers, and then taking 3 systolic blood pressures in the upper extremity and averaging those numbers. Then you do ankle over brachial to get the ratio. And the ratio should be around 1. If it's less than 0.8, that can indicate some lower extremity ischemia. If it's falsely elevated, if it's 1.3 or 1.4 and someone with diabetes and kidney disease, that can indicate a circulatory issue related to non-compressibility of the vessels. So to do the ankle brachial index, you just need a ultrasound monitor. It's called a Doppler. And there's only 2 buttons on the Doppler. On the front, there's the power button. So you just turn it on when you're ready to use it. And on the side, and if it's facing the correct way, the left side, you can turn the volume all the way up. So the volume is on the left side of the Doppler. So I'm going to put that down on the plinth first. The other items you're going to need are ultrasound gel for the Doppler. So I'm putting that on the table. And a blood pressure cuff, which we're going to use to take the systolic blood pressure. And a stethoscope. We actually don't need the stethoscope for this example because we have a Doppler, but you can use a stethoscope to do this. In the absence of a Doppler, you can use a stethoscope in the ankle and the arm and compare. In lab, I'm going to ask you to use both to see what you think about the comparison. The first thing you need to do is have your patient always laying flat. You should not have the patient sitting at a 90-degree angle because you want the blood pressure to be similar in the arm and the leg. And you want to do the same side of the body. So if you're looking at the left leg, you want to do the left arm. And if you're looking at the right leg, you want to do the right arm. We're going to use either the dorsalis pedis or posterior tibial artery in the foot as our place for measuring the blood pressure. It doesn't matter which one you use. Inevitably, it will be easier to find one than the other, and you just use that one that you can hear more easily. In order to find those spots, I usually have the patient turn their feet out like a penguin, right? You only have to do 1 foot at a time, but. And then there's the medial malleolus, that bump on the ankle, and there's the calcaneus, which is the back of the heel. And if you go in between there, you should be able to find the pulse of the posterior tibial artery. And that's where you're going to want to put your sensor probe so that you can hear that artery. If you're looking for the dorsalis pedis artery, you can point the toes in the air and go to where the foot crease is, and you'll be able to find the pulse there. So for the purposes of this video, I'm going to use the posterior tibial artery. So I am going to place the blood pressure cuff around the ankle as low as possible, because if you put it too high around the calf, it can actually cause pain, and that pain will cause the patient to possibly flinch, and that could affect your measurement. Usually I put the sphygmometer on the table so I can see the numbers as I pump up the cuff. If you have an auditory one, that's fine as well. And then I'm going to put the ultrasound gel in between the medial malleolus and the calcaneus on the medial side of the foot. I'm going to turn on the Doppler and turn the volume all the way up. You can kind of hear it. I don't know if you guys will be able to hear it on the video, but you'll hear a whooshing sound when it comes on. And then you find the artery. Usually I'll find it somewhere in between the the malleolus and the calcaneus. So it may take you a minute to find it, which is fine. You can hear it there. I want to try to get it as loud as possible. Okay, so you guys should probably be able to hear that pulse. I'm going to pump this cuff up until that sound disappears. And I'm going to let the air slowly out. And when the sound comes back, that's my first systolic number. I'm going to immediately pump it back up again and go through the second systolic measurement. And I'm going to pump it up one more time. And I'm going to get the third systolic measurement. Okay, so that's how you get the systolic blood pressure in the lower extremity. Some tricks of the trade would be grounding your arm against a surface so that you're not up in the air like this. Providing enough pressure on the artery, but not too much that you're occluding it. So if you're having trouble hearing it, you may need to let off on pressure, you may need to add a little pressure to try and find that vessel. The other thing is, if you put this cuff around the leg before you find the vessel and you're having trouble finding the pulse, you can always undo it, find the pulse, and then put it back on. Sometimes the cuff can restrict the lower extremity blood flow a little bit. All right, so we got our 3 systolic blood pressures in the lower extremity. They were around 130 each, so we're going to say the average was 130. You guys will be more technical about that average, but for demonstration purposes, you want to have a towel so you can clean off all the ultrasound gel cream stuff. Hopefully I got it all. Excuse my cough. Okay, and now I'm going to do the arm on the same side of the body. So just like you take a regular blood pressure, you're going to find the brachial artery. You can find the pulse on the medial side of the arm if you want to before you put the cuff on. So you're going to put the blood pressure cuff on. Okay. Same as what you did for the lower extremity. You're going to place the sphygmometer in a place where you can see it. And you're going to get your Doppler ready by turning it on and turning up the volume. You just need a little ultrasound gel, and hopefully we're going to have as much luck finding the brachial artery as we did finding the posterior tibial artery. So we'll turn this on. Gotta find where's the pumper? Hold on. Oh, it's in my hand already. Oh. Senility. Okay. So I'm going to lay this down. Okay. I'm going to find the brachial artery. I hear it, but I want to see if I can hear it louder. Okay, and then I'm going to pump it up till I don't hear that sound anymore. I'm going to let the air slowly out, and when the sound comes back, that's going to be my systolic blood pressure number 1. Okay, I'm going to go again. Systolic blood pressure number 2. Okay, and one more time. Systolic blood pressure number 3. Those were about 120. So I had 130 in the ankle, 120 in the arm. That's going to be a ratio that's above 1. And being that he does not have any diabetes or kidney disease, that's going to be a normal finding for blood flow. That's what you want to find, okay? Trying to think of some tricks of the trade here for you. You can lift your arm here. Again, make sure your arm is grounded. Make sure the patient is laying flat. And make sure that you're applying appropriate pressure through the Doppler head so you can hear the pulse as loudly as possible before you inflate the cuff. Places people struggle on the practical is they have the patient sitting up while they're doing the exam, or they can't find the pulse. So make sure you practice a bit with the Doppler before the practical so that you're really comfortable with it on the day of the exam. You never know who you're going to get. All right, so that is the ankle brachial index.